just sharing with you our last conference of the year. We've had 4 conferences this year. I think been a really easy way for us to provide up-to-date information. Lithium, we've talked about lithium and cancer prevention, head injury, aggression, Alzheimer's prevention and suicide prevention, binge eating and food addiction, genetics and psychiatry. And our last one is looking at child psychiatry redefined, looking at effective approaches for autism, ADHD, depression, anorexia, pandas. I think it's quite frightening the amount of medications we're using on kids, and pretty dramatically, it's also frightening how poor the outcome is for medication use with kids, except for stimulants and ADHD. The outcomes for depression and autism and every other psychiatric illness is really poor. And these are our speaks. These are all physicians, well-trained, experience, and the content. What do we have? Dr. Hendren was my mentor when I was in the residency, the president of the child psychiatry division a number of years ago. He's going to talk about epigenetic interventions in autism. I'm going to talk about anorexia, ADHD. Andrew Farrer is going to talk about micronutrients, particularly folate and MTHFR in depression. Dr. O'Hara, pandas and ADHD, again with me, and omega-3s by Dr. Simkin, and broad spectrum micronutrients, Dr. Villagomez, and disruptive behavior disorders. So it should be, I think, a well professionally organized conference with lots of information.